Okay, welcome to Roasted Academy. So today let's look at the femoral triangle. Okay, we've already looked at the anterior, posterior, and medial compartment muscles of the thigh. So one of the most important structures that we have to look at is going to be the femoral triangle. Okay, this is simply going to be a wedge-shaped depression that is formed by the upper thigh muscles. So it's going to be on the anterior thigh that is going to be there. Okay, so it's a junction between anterior abdominal wall and the lower limb. So we have got important structures here, the neurovascular structures that are going to be passing through the femoral triangle. Okay, so here we've got the femoral nerve, for instance, femoral artery, okay, femoral vein. All these are going to be passing through the femoral triangle. They are going to be basically the contents of the femoral triangle. Okay, accessed relatively easily, an area of both anatomical and clinical importance. You see, when you start talking about clinical relevance of the femoral triangle, there are femoral hernias that we can have here. Okay? A femoral tap is done from here as well. So whenever you're looking at an important structure, okay, you really have to go in as much as going into the clinical importance or clinical relevance of that particular uh, structure that you are simply looking at. Okay. So what are the functions of the femoral triangle? Like I said, so it's going to be a passageway of important vessels and nerves, and is a common site for vascular access. Accessible route for placing IV lines. Okay. Femoral hernias, like I said. Okay. Lymph node examination. And then now we come to the boundaries, right? So always how I remember, in order for you to have this, it's where you look at the walls, you look at the roof and the floor, and then you look at the contents now. Okay, yeah. So these are the boundaries or walls of the femoral triangle. Okay, so it's basically a triangle. A triangle basically consists of apex, the base, okay, the lateral wall and the medial wall. That's basically how it is, right? So let's see. Here we've got the medial wall, the lateral wall. Like I said, the base. There, the base can also be known as the superior boundary. Okay. We also have the peak apex. Okay. So for the apex here we have you will see that we've got where the sartorius crosses the adductor longus. Yeah, that's about that. So we have the floor as well. The floor is going to be formed by the psoas laterally and pectineus medially of the roof, the fascial latter, cribriform fascia, subcutaneous tissue, and the skin. Okay. So like I said here, let me mention about the medial wall. Medial wall, we have the lateral border of the adductor longus. So the adductor longus mass is the one that forms the medial wall of the femoral triangle. We have laterally, okay, the lateral border is going to be formed by the medial border of the sartorius mass. So you need to make sure that you are taking, you are differentiating, right? Okay. If it's the sartorius muscle, we have the medial side of the sartorius mass, the one that's going to form the lateral wall. While on the medial wall, we're going to have the lateral border of the adductor longus that forms the medial wall. Okay. So you need to take note into that, right? So we have the apex, I think I've already mentioned. Superiorly here, we've got the inguinal ligament. There's an inguinal ligament that is there as the apex, the base. Okay. Inguinal ligament, very important. Okay, in that is an important marker where these particular vessels, when, for instance, they are moving from the abdomen now, just after passing through the inguinal ligament, they change their names like that. Okay, yeah. So that's when we have got the names like femoral nerve, femoral artery, femoral vein, just like that. Okay. So for the contents of the femoral triangle, I think you remember it by nerve. Okay, NAV, where we've got a nerve, an artery, and a vein. So if you look at this, just within the femoral triangle, right, we have what we call the femoral sheath. These are the contents of the femoral sheath that are going to be there. So we've got the femoral artery and its branch, the femoral vein and its proximal tributaries. These are going to be part of the femoral sheath. Okay? So we have the deep inguinal lymph nodes, the lateral cutaneous nerve of the thigh. All these are going to be contents of the femoral triangle. Also include femoral branch of the genitofemoral nerve, runs in lateral compartment of the sheath. Supplies majority of the skin over the femoral triangle, femoral fatty tissue as well. So this is the femoral sheath that I was talking about, right? It's a funnel-shaped fascia tube that encloses femoral vessels, terminates inferiorly, blend with the adventitia femoral vessels, creates femoral canal medial to them. Okay. So that's about this one here. You can see here we have lateral, intermediate, and the medial components. So the femoral sheath is going to be split into three compartments by what we call as posterior septa. Lateral compartment, we have the femoral artery, okay, the femoral branch of the genitofemoral nerve. On the intermediate compartment there, we have the femoral vein, okay, femoral vein. While on the medial compartment, we have small and called the femoral canal. So we have the femoral canal there. We'll talk about the femoral canal and this significance as well. So note that the femoral sheath doesn't enclose the femoral nerve. Okay, you need to really take note into that one. Okay, so femoral nerve is not part of the femoral sheath. It is the site for femoral hernia. That's femoral sheath. So here now we've got the canal, which is the smallest component, like I said, conical and short, and it's about 1 to 1.25 centimeters. It's located in the most medial part of the femoral sheath. So it extends distal to the level of proximal edge of saphenous opening, allows the femoral vein to expand. That's one of the things about the femoral canal. So its upper opening, called the femoral ring, is closed by extraperitoneal fatty tissue. Okay. Yeah. So the femoral canal, the contents are going to be the loose connective tissue, the fat, the few lymphatic vessels, deep inguinal lymph nodes. All these are going to be contents of the femoral canal. Okay. So for the boundaries, anteriorly it's going to be by the inguinal ligament, while medially it's going to be by the lacunar ligament. Posteriorly, there is what we call pectineal ligament and the pectineus muscle. That's about the posterior. Lateral femoral vein. Superiorly covered by the femoral septum. Those are going to be actually the femoral canal. This is one of the most also important structures as well. So we've got the femoral canal, we have got the femoral sheath, as well as we also have the femoral canal. All of them we have to take into consideration what is not in what is in what are the contents of the femoral triangle, just like that, the way we have just been illustrating here. Okay. So we have lateral cutaneous nerve. Lateral cutaneous nerve appears beneath psoas major border above iliac crest and runs downward and laterally across the iliac fossa, enters thigh below inguinal ligament lateral end, give cutaneous innervation to upper lateral thigh. Also have deep inguinal lymph nodes. There are 3 in number, located medial to upper femoral vein. Okay, lowest located below great saphenous and femoral vein junction. Middle in the femoral canal and greatest one in the femoral ring. I've already mentioned about this. So now next session we need to look at the adductor canal. Okay, we need to look at the adductor canal. Yeah. Okay. Thank you so much for watching. Please